Hi, this is Erica Dorr. I'm the Associate Director of North American Thrombosis Forum. I'm here with Dr. Marc Pfeffer, cardiologist at the Brigham and Women's Hospital and Professor of Medicine at Harvard Medical School. Dr. Pfeffer, this year you have been selected to be the second annual Arthur A. Sasahara Lecturer. Would you be able to give our audience a background on your experience and the point where you began your relationship with Dr. Sasahara?
Well, first, Erica, thank you. And I must say how thrilled I am to give a lectureship with the name Arthur Sasahara attached to it. Dr. Sasahara is a pioneer, and I'd have to say a gentle giant. I've known him since I was an intern, so I won't even go back to how many years that was. When I was on the medical service at the West Roxbury VA, and of course Dr. Sasahara was the chairman of medicine. The beautiful thing about the West Roxbury VA then, and I believe still now, is the way everyone came together. The chair of medicine doesn't hide in their office. The chair of medicine is very visible, very approachable, and there to help. And Dr. Sasahara was certainly all those things and more. He really set the tone that if you're a patient, a veteran who needs inpatient care, you're going to get the best care we have. And that was Dr. Sasahara. It was just, there's no shortcuts, there's no cutting corners. What do we need to help this person? And who can help you best? And that's the other thing about medicine, is that you're really not an island. Probably the lowest days I had as an intern when I had that feeling. But I didn't at the VA. You could always turn to somebody, whether it's your senior, the attending, or even the chief of medicine walking 4 North and just catching him and asking him a question. And it's that type of welcome to medicine I had here as an intern that I've tried to build on and tried to keep. So now, specifically, Dr. Sasahara. In our intensive care unit rounds, this unflappable person who, when you're having high anxiety, just a calming influence of how to get the best out of all of us. Now, of course, I've known him for another 30-something years, and with that duration, those 3 decades, I can now say first impressions, 100% right, sincerity, integrity, and a man whose compass points to the north. So just knowing this man has made me a better person, and because of that, I feel so honored to have my name attached to his lectureship.
What do you think are some highlights of Dr. Sasahara's career?
Dr. Sasahara is a builder. I now do clinical trials. I enjoy it, and I think it's a privilege to do a study where you ask a human being to participate, where you hope at the end that there'll be an improvement in patient care. You don't know that. What you do know is you'll do your best for all involved. Dr. Sasahara, through the VA, and by the way, I have to stop here, the first major clinical trial in cardiovascular medicine was the VA cooperative studies in hypertension. So the beginning of randomized controlled trials in cardiovascular medicine started with the Veterans Administration. And here's Dr. Sasahara addressing questions that the single doctor, the observation, the being a good clinician could not address. And building a team, developing a clinical trial really required cooperation, the name in the first veteran study. And Dr. Sasahara attacked pulmonary embolism, still a fatal disease, underestimated. And he not only attacked pulmonary embolism, but he developed diagnostic techniques. How do you make the diagnosis? Now again, I'm talking about 30, 40 years ago. And how do you influence this progressive disease that leads to death so often? And every disease has a whole spectrum, and he was taking on the end of the spectrum. Those who had overt pulmonary embolism, those who had detectable pulmonary embolism on angiography. So we developed the techniques, and then heroically, I would have to say, by today's standards, thrombolysis. Now, it now has a place, but wow, you know, do no harm. Do no harm means I have a tool in my hand that might hurt someone, but it might help. So you really got to get that balance of the right patient for the right therapy. And he proved that outcomes can be improved, but it's a tough therapy to give, and you have to select your patients very carefully. But it's what I was answering in my first question about Dr. Sasahara the person, Dr. Sasahara the man, Dr. Sasahara the physician. He's the first to say do no harm. So here he is with a double-edged sword and teaching us how to apply it.
Is there anything else about Dr. Sasahara that you would like to share with us?
Well, I think when you look at someone's career, you have to look at the overall contribution. And the amazing thing for me about Professor Sasahara is his sustainability. What I said in my intro about when I was an intern walking up to him applies 36 years later. I could still walk up to Dr. Sasahara, ask him a question, and get a meaningful response that will help me. He is still contributing to better understanding of thromboembolic diseases, better understanding of just what I was saying in the last question, the right patient for the right therapy. He still participates in patient care. He still participates in education. So whatever I said on my first impression, multiply by more than 3 decades, and you get a better picture of Dr. Sasahara.
Well, thank you for taking the time to speak with me today. It's wonderful to hear about your relationship with Dr. Sasahara. I know that he thinks very highly of you as well, and we're really looking forward to your talk.
Thank you, Eric.